And welcome to another Thursday Live here at the AOPP. I'm Dr. Jerry Dreessen. Today we're going to be talking about using PEMF and light therapy and when the combination makes sense. So I would love to hear your comments along the way. Again, if you are watching the recorded version of this, just jump right in and drop your questions in there. Or if you are here on the live, then of course you can drop them in and just say hi too as we get going. So as I continue to clear my throat, here we go. Let's get started. So in essence, when PEMF and light therapy, when you combine them and it makes sense, for clear practical guidance on stacking safely. And again, this is just educational only. It's not medical or veterinary advice. This is oftentimes we get this from our members and the information they give us, and we put that together too. But always, if you're working with a client or an animal that has a primary care physician, I guess, make sure you're working with them as well. So that's our disclaimer. Let's get rolling. So as far as the goals for today, of course, is for all practitioners, whether they are in clinics or mobile providers, or if you have a brick and mortar, learn when combo care is reasonable, and then as far as the sequence, session length, and tracking, and then also being able to document ethically and avoid over promising, which I'm seeing not a lot, which is good. So that's, you guys have done really well. It's usually the people that are just starting out that are learning about this. They have a tendency to want to really talk the game that PEMF and red light are, which we know they are. But again, when you are bringing in people that have never heard of this before, it's better to under promise and over deliver, I guess, so to speak. So that being said, let's jump in here. So as far as the scope and safety and the device, let me make that a little bit bigger. There we go. So scope and safety, as far as we here at AOPP, we are device agnostic. So we don't have any brand names that we promote, nor should we. We're an all-encompassing organization, and there are lots of PEMF devices and also lots of red light devices that are out there. Do your homework, learn your device, know what the difference is between a good brand and a bad brand. Kind of like cars, there's the good cars and there's the bad cars. What's the difference between them? And it's transmission, it's engine, gas mileage, battery mileage, all of those things that we look at when we're buying these things. These devices are the same thing. So again, PEMF red flags, pacemakers, if you have any kind of ICDs or if there's a pregnancy caution, if there's any kind of bleeding or surgical sites. And then with light therapy, red flags, intercochlear devices, and if there's any kind of hearing aids, that's ICD. Red light therapy, red flags, again, eye exposure. So if you're working around the face, make sure you're getting rid of that. Any photosensitizers. So if somebody's on medication where they are using light therapy and they have enhancer medications, heat sensitivity again, and malignancy cautions. Then, of course, as far as on the veterinary side, just follow the jurisdiction and the vet referrals on that as well if somebody's working with a vet. In the evidence spotlight, again, PEMF, really good with circulation, great for edema and cell signaling. Comfort and function. Animals, they just get up and walk away. They let you know by leaving. Humans are a little bit different. Some of them are like, well, I thought it would be best if, the more you could give me, doc, the better. I hear that. Just crank it up. Not necessarily good for people to have it on high, as you know. Sometimes low grade is the best, where we have you just kind of ramping. Well, I guess the difference between boiling and simmering, right? You can boil something and it's not going to taste good. Whereas if you had that nice long slow simmer, that's a good way to think about PEMF. So boiling versus simmering, what's best for the client? Light therapy, of course, as well as PEMF, the mitochondrial support, but the oxidative stress modulations and superficial tissue depth, that's all part of it. So both of these devices go really well. In fact, I'm seeing attachments that have both. So it's a combination of both red light and PEMF together at the same time. And it can be done that way. You can have, individual devices and having them present at the same time too. And you're going to see really amazing musculoskeletal recovery, skin integrity as far as equine and canine rehab. Those of you that are doing this already, you already know what I'm talking about. If you've never heard about this, just know how amazing these devices are and how it works. And again, evidence limits. So make sure that you are working with the parameters of the research and also some few as far as the direct trials that are out there too. People are like, how do we know this is going to work? If you have some quotes or even the research articles printed out, and some people, they'll laminate them so they can just hand it out. It's just like the highlights of the research. All of that's great. It helps build your business and get you into more doors as you talk with professionals about this. Next is some case examples. So on the human, as far as tendons and overuse, just be careful. So, you have a baseline, you have the numerical rating scale. So for them, that 0 to 10, oswestry, 0 to 10, how do you feel? 0 being no pain, 10 is the worst pain ever. And it can be those little faces from a happy face to a crying, screaming face. There's all kinds of ways to do that. And then also testing the function. So if they have shoulder pain, well, what can that shoulder do? What can it do with gravity? What can it do with you moving it? What can it do with weights? And map that out. So that way, after you're done using it, they may still have pain, but if their function improves or if function and pain improve, you've got those things, and then chart that out. Because in a few days, especially if you work with a lot of people, you're going to forget those things. They're going to forget them too. If you say, remember when I came in and we did this, this is how you were before, this is how you were after. And I had told you drink water before and after, those kinds of things. And so it's always great for follow-up. Oftentimes people are like, well, how often should I do this? Well, what's your baseline for each of these injuries? For a muscle problem, is it just, we'll treat it once for 30 minutes and see how it is, or we need to do this 2 times a week for 6 weeks? We talked a little bit about that as we were last week as far as charting things. And we have lots of, hi, Kathy. Yeah, you're welcome. It's good to have all that cool stuff out there for everybody, because again, we're rehashing this. And then as far as the order, what's your PEMF, what's your red light therapy? These should all be little tick boxes on your chart for that person or animal. And then whatever co-care. So do they need exercise? Do they need sleep? What are the steps that you've put together for them? And then the as far as the outcome. So on the numeric scale, did they go from a 7 down to a 3? Did the function improve? So those are some great notes to have. It's also really good if you have something like that and you can take a case study of your own and, make a copy of it, black out the name, and you can show healthcare professionals, here's the sample. Here's Mrs. Smith. This is her neck pain. This is after 6 sessions. Here's what we were able to take her from this to this. So that's really cool too. If you can provide that through your own clients, that's really, really strong. Into the veterinary world. As far as like a canine wound, so what's the wound size? What's the comfort scale? And again, are those of you that read animals, if they're what's the word I'm gonna say? If they're anxious, if they pull the paw away, if they allow you to touch it, if the vet's okay with that, as far as signing off on it. Same thing, 3 times a week for 4 weeks. Have the owner check on some stuff, call them and ask them how they're doing. And again, you can have PEMF 8 to 10 minutes, red light 6 to 8 minutes. Track the wound with photos. That's great. You got your phone with you, so you can track that. And then also, comfort reports. So the owner is going to be able to tell you if they're walking with a limp or if they're running around now. And are they sleeping better? Are they, more comfortable? Are they sleeping longer? All of those things. That the more information you can add into your list of things about that session or that animal, the better. Because it just gives you more bragging rights, I guess, but also case studies for yourself. So some best practice plays. Remember, there's a decision tree to make. So comfort and edema, PEMF first, usually skin and wound, red light therapy, and then a joint load. So having a combination of the two. And then you decide. So we're seeing great results with all of that. And the more you use it, the more you're going to know how to specialize. When you see something in your brain, you're going to go, okay, that's going to be, PEMF first for 10, and then we'll do red light therapy for 5. See how that works. Come back tomorrow, or it's like based on that, we know what we're going to do. We're going to jump right in and we're going to get that system going. And then as far as sequencing, the same day. So, is it going to be 30 to 40 minutes? Are you going to alternate days? You can adapt to manuals, but just, the key thing is just avoid overdosing. And in the human world, it's going to be based on, are they on medication? And even animals too, if they're on medication, you need to make note of that, because again, remember, anytime you increase blood flow, you're going to increase medication absorption. So, and then with that is drinking fluid for detoxification. And those are the key things, to always remember and put in your notes. Some templates. If you already have when you come in, you already have a set of templates. Well, based on shoulder injuries, this is what I do. Based on low back pain, this is what I do. Based on, wounds or injuries or broken bones, this is what I do. So usually with acute edema, you're going to want to have a combination, but it's usually more PEMF than it is red light when you're starting out. And then if you are doing on a tendon side, you might want to incorporate some isometric exercises along with that, so that you're using that tendon through the beam of the PEMF, but you get distribution of the attachment and the sessions with that too. Equine recovery, again, know the hot spots. Again, I've seen horses with PEMF. I don't treat horses, but I do know that you can see secondary twitching going on, or afterwards, area that had the session on it, there's still some twitching going on. But you're also basing it on the animal. You can tell that they're enjoying it and that it feels good to them. Just make sure you're noting it. So afterwards, after session, there was another 10 minutes of twitching right at the affected area or on the opposite side. Just any observations that you can include in that makes it. And again, with humans, safety goggles, animals, making sure that they aren't getting direct access to the light, red light therapy, and then do some skin checks, some heat checks, and then just make sure that you are monitoring any infection that's going on, infection control. Ethics and implementation. So use function first outcomes, not cure language. So we're not curing anything. We're just making the area's function improved. So I always like to tell patients, we're going to decrease your pain. We're going to improve your function. I'm going to get in. We're going to be working on your body so that the inflammation decreases and that the body can begin to heal itself. And we never say that we're going to cure your headache, or we're going to get in there and we're going to fix things so that your headaches are going to decrease because your body's functions are better. So that's the language to use. And I would, all healthcare providers, remove the word cure and just, improving function, improving range of motion, decreasing inflammation, decreasing pain. And that's really what we want anyways, right? Anytime we go see a healthcare professional, it's like, well, I want to have improved motion. I want to have decreased pain, and I don't want to have any long-term problems as a result of the injury. So if you can speak that language, then that's your gold nugget for today. And then also document reasoning. So there are the outcomes. When people are like, is this thing working? Well, let's take a look. Last week when you were coming in, this is where you were when you started. And again, people often forget. And also with animals. And so using your phone, you can actually record the gait of the person walking or the animal, and then they can see the results. And speaking of results, Laura's asking a question. Yes, Laura, this is a live broadcast, but right afterwards, it's going to be available, so you'll be able to watch the recording as well. So if you missed the start of it, it'll be there, and you can do a search on our PEMF group, and based on our title, which is the red light and PEMF, or even the date. And again, as the target, the human or the animal, is getting better, then you should be able to taper off on the frequency of care. So as they get better, your care should taper. And then if you have them on a maintenance program after that, I've got patients that come in and once a month, and they'll use PEMF just to kind of top off the tank and make sure that all of the things that happened don't start off again. So, especially if they have some underlying health problem, like some degenerative arthritis, you want to help them prevent that from flaring up again. So they will always need some kind of ongoing care to keep things at bay so that the inflammation doesn't sprout up again. And as far as pricing, we talked a little bit about this last week. So, we have a trial price. There's 3. We'll do 3. It'll be, Monday, Wednesday, Friday. So there's that package, a trial package. There's a plan. So, it could be 2 or 3 times a week for 6 to 8 weeks. And then there's monthly. So you can stagger your own menu. Like when you go into, the store, the fast food, there's things that you can buy in prices. There's workout memberships. So there's a monthly membership. There's, try it before you buy it kind of thing. So, the trial offer is really good. And then communication. So it's really good to have your pre-session, your session, and your post-session memorized and to put it together. In the world of chiropractic, we say, before we get started, we have 2 concerns. Number 1, what's wrong? What's the problem? And second, whether or not chiropractic can help. So I'm just going to ask you a bunch of questions. And after I'm done talking, if I missed anything, you can let me know. And then after that, we're going to do a complete orthopedic and neurological exam to find out what's wrong in the area. And then if I think I can help you, I'll tell you, and we'll put together a plan and get going on improving your function and reducing the pain. Are you okay with that? So something like that, just, put together that way. I've got a little bump here. Let me bring this up. Hello from Norway. Hey, we are live in Norway. That's awesome. What is the maximum time that is safe to use per day? That's going to be based on your device. If it's red light, if it's PEMF, if you have a one of the big PEMF devices versus a small independent one. If you are just starting out with somebody, we always talk about low and slow, low settings, slow amount, minimum amount of time. And for me, I wouldn't go more than 30 minutes of PEMF for somebody that's acclimated to it, making sure they're drinking water before and after. And again, red light, it's never going to be more than 5 to 8 minutes for areas at a time. You can repeat that, so somebody can do, in my opinion, somebody can do red light twice a day, so they can do like a morning and evening. But you always want to check and always start out very minimal in case they have some kind of reaction, and then you can go with that. So I hope that answers your question. And I was just looking at, I've been using it for 1 year, twice a day. Yeah. And for me, when I injured my shoulders, I was using PEMF 20 minutes, both shoulders. And I was doing that 3 times a day. And I was doing that with rubber tubing exercise and moving them around and drinking lots of water, making sure I was helping my body detox. So that was from an injury that I had, and I had been using PEMF in the past. But when I started, it was, let's just try 5 minutes, see how it feels. Let's try 10 minutes, see how it feels. Let's do 15 minutes, see how it feels. Let's do 10 minutes twice a day, see how it feels. So you can see how I kind of staggered it up. And that way, if there was too much, you can't go backwards, but you can always go forward on your care plan. Hope that makes sense. Let's see here. Let's go into our last slide. So the wrap up and takeaway. So again, PEMF supporting circulation and comfort. Red light supports cellular energy and tissues. Those are kind of the basics. But again, PEMF, based on the unit you have, can go all the way through the body. Red light, it's like shining a flashlight in a cave. It's only as good, it loses its power the further into the tissue, but if there's a bone, it can't go through a bone. It stays up against the bone. So if there was a cave and a rock in the middle of the cave and you're shining your flashlight, you might be able to see the back of the cave, but when it hit the rock, behind the rock, you're not going to be able to see it. So if you think of red light like that, and it can only go so deep into the system, so it's more designed for tissue and just below the derma inside the tissue, whereas PEMF, different type of therapy, different system that's going on with the magnetic therapy, but it goes all the way through. It's great for fractures. If you've got a cast on, you can cast over it. Make sure if somebody's got a metal pin in there that you're careful with that, because it will increase calcification around the pin too. So those are some things to be aware of, but it will definitely heal bone quicker. And that takes us to the end of today's live. Thank you so much for jumping on here and learning a little bit about PEMF and red light. Again, drop your comments in this live, even after we're done during the recording. If you have some tidbits you'd like to share with us, that would be awesome. If you are seeing this for the first time and wondering what is PEMF, what's AOPP, jump on over to our website. You can find out all about it. We do certifications, so we have different levels of certification. If you want to get out there and do this as a business, or you are doing it as a business, and you want certification from a national organization, then we are here for you. Just jump on. You can take a look. And Katie, you're welcome. Thanks for joining me today. And again, info at PEMFprofessionals.com. We are around. Also, I didn't drop the slide in, but we are doing our PEMF Con, and that's going to happen in November. There's going to be more talk about that, so set your calendars for the first week in November. I believe it's the 6th. And we'll talk more about that in the next live too. But for now, jump in, like what you're seeing today. Again, we're also live on YouTube right now. We're also live on LinkedIn. So, and in Instagram, we've got we push it over there too. So jump over there, like all of that. That helps our algorithms get out in front of more people. And look forward to seeing you again next week on our next live. And until then, take care and keep on PEMFing. All right, take care.